Mhm.
Well, hi everybody, and welcome to our inaugural weight loss slash with lipedema, looking at weight loss medicines uh, for lipedema, specifically the GLP-1s. And um, so I wanted to start off and just kind of explain. I mean, just a little bit about the GLP-1s. So, and you know, basically these are incretin molecules. So they are they which are basically gut produced and released hormones that con uh, control, well, they have many effects, including regulate glucose homeostasis or control glucose levels, as well as they send signals to, like, we know probably 15 different tissues and cell types that receive signals from these GLP-1s. Everywhere from the brain, where it um, gives us a sense of satiety, and may have other effects on the brain to immune cells, fat cells. Of course, these so these are so the a little more about the specific incretins. So GLP-1 is secreted and um, part partly uh, um, from the pancreas, and then GIP is actually made by a cell in the intestinal lining, a K cell. Not, I mean, I don't want to get too like in the weeds, but these are, I mean, these medicines have so many beneficial effects. I mean everything from lowering heart disease, risk for heart attacks, risk for strokes, risk for kidney disease. I mean, and we're just, I mean, it, there's not a week that doesn't go by that we don't have a new study showing another benefit. And they've, even though these medicines have been around for 20 years, I mean, the science on the effects of these are just, it's just exploding. And so these, and so we one so why did I so just a little more, so like these are like uh 20 to 30 amino acid proteins. So there's two compounds, semaglutide and tirzepatide, and they're both about 20 to 30 amino acid proteins. And and the semaglutide is just a GLP-1, so that's agonist, and then tirzepatide is both a GLP-1 agonist as well as a GIP agonist, and that's um,
What is the difference in how they're working if one is just a GLP-1 and one is also a GIP? Like, how is that different for a patient?
well, I mean, GIP also is involved in sensation of satiety. So it does have a second mechanism for satiety. It also has it also causes glucagon release. I mean, it has many of the same effects of uh, as the GLP-1s. So it has a, but they're not quite equivalent. There's actually um, and I actually I don't have the papers pulled up right now, so I'm not gonna say, but they they have slightly different effects on carbohydrate metabolism. Um, and
But you're not recommending one over the other for any of our patients. It's basically which one they want to choose. And like I've told them that, some people they tolerate the tirzepatide and not the semaglutide. Some tolerate the semaglutide and not the tirzepatide. So it's kind of a game that we have to play right at first just to see, you know, what they're going to tolerate. And if we need to switch, we certainly can. But
yeah,
one is not better over the other, correct?
no. In fact, I consider them equivalent. And it is really kind of a personal, like I so there's going to be people that are going to do better on the semaglutide and people are going to do better on the tirzepatide, and I think they are equivalent. They have slightly different of I mean people have slightly different responses to them, but there's so much overlap in between the responses that I think they can be they're essentially equivalent. Um, they're just um, and so why I want to really know, so I mean, obviously we're finding this on many diseases, but no one's looked at this with lipedema. And I think so this really came to be because I've had started a couple years ago when patients who were on these medicines were saying, it's really helped my lipedema pain or my lipedema swelling, and that that has been, I heard it enough. I'm like, there's something there, and this is regularly reported before they even lose significant weight. But I don't want to coach you guys to think that. I just want you to know that that's what I've heard. And I wanted to look into this further. And so this is sort of the first step as far as looking into this further. And I kind of want to go a little bit more. Well, I'm gonna talk about what sort of things we're gonna follow, and then what I hope to do if I get enough participation um, with my patients and hopefully get more people with lipedema and non-lipedema in um, uh, to follow this data. The more data, obviously the more powerful, more convincing story and more insight I'll have will have. And it's kind of open book because I mean I'm kind of it's kind of fun for me because you guys are kind of your feedback helps, like your feedback gives clinical insights, which then I can look dive deeper into. So this has really been definitely a patient it's a patient initiated thing. I mean, it came from patients telling me about this, listening to the patients, and then inquiring further on that. And that, so that's great. I mean, I'm lucky to have, patients, who are willing to, think outside the box a little bit. So, um, so we're looking at so one thing there's some lab work that I want we do on everybody, and why so I we want to check basic liver health, um though we will also look at the AST or levels, because some so liver tests, we will follow the AST levels, can be an indication of fatty liver disease. So and weight loss may lower them, and that would be interesting to see. But that's that's a side thing. We also look at the kidney health, and so these are largely most of these are degraded, and components are, so they're mostly degraded by a dipeptyl peptidase hormone, or dipeptidase enzyme, and and these peptides are usually then the broken down peptides are secreted in the urine. But so so I'm looking at your average blood sugar because I want to see like how these are measures of the fasting blood sugar, and your average blood sugar are measures of insulin sensitivity. And generally we think of lipedema ladies as just a little more insulin sensitive than for their BMI than normal people, but that still they get insulin resistance, and so and they become healthier with weight loss and more insulin sensitive, which is a marker of metabolic health. And so we're going to be following those, as well as the C-reactive protein. And then which is a really important marker of inflammation. And I really hope to see that, my hypothesis on this is that this will lower the CRPs of the lipedema patients. We would like to prove that. And then, uh, and then also, like, we're checking thyroid function to make sure, obviously thyroid and lipid function, because these have an effect on lipids and thyroid, but we want to make sure thyroid can abnormal thyroid hormone levels, or thyroid or insufficient thyroid hormone can affect your lipid profile, and even your glucose homeostasis. So um, I got to stop using these big words. Your glucose levels, I guess, is
Ladies, you know Dr. Wright well enough that you know he loves to nerd out, so it's all good, right?
It's fine.
please,
I'm a translator here too, so we're good.
please, please stop. Like, if I say something that, feel free. This is a small enough group. I mean, you certainly can, if you have a question about something I'm saying or whatever, please feel free. And then, those are the main outcomes, main, laboratory outcomes I'm looking for. But certainly um, I'm interested to see, um, uh, you know, we are checking B12 levels as well. Um, and so that's where, so then the probably the most important part is the surveys. And that's the thing, is people need to understand we want to survey you sequentially. So every month we want you to fill out the survey. It's just questions. I'm going to go through that in a little bit. Um, just kind of what we're looking for, but basically, um, to look at when or if it changes your the like leg pain, when or if it affects swelling, when or if it has any effect on your exercise tolerance or exercise pain or post-exercise pain. And those questions are really because those are things that have been remarked or reported to me by my patients. And so um, I want to see if there's more to that. So then, if we find something here, and we want, then, there's a lot of people. I've talked to the Lipedema Foundation, And we are going to be reaching out also to Eli Lilly to see if they might be interested also in, you know, studying this and funding a more comprehensive and rigorous study. But it always has to start with this is the kind of stuff that starts with this. And I was this reminds me back to my early years in medicine, and I was how at the Howard Hughes Medical Institute. It's on the campus of NIH, and I was um, all these people, they were all these great scientists who had made great discoveries for medicine, would start with these sort of clinical insights, and they were in my early years, they're sort of my heroes, and so still are, but that most of them have since passed. So um, this is that's what what gets me thinking about this stuff. So I'm going to go into the survey a little bit, and then so again, there's some. So we're looking at some just we want to know what which medicine you're using, and when when you started on it, and we want to follow your weight. So we everybody has the scale and the body composition. We'll follow those. Those are also important outcome or endpoints. And then just regularly um, rate pain, swelling in your legs, pain after exercise, some global health measures, because those, um, um, like just I just chose some simple global health measures because I, you know, again, there may be other benefits that, we're not picking up, but maybe have effect on your global health, or we haven't thought of yet, um, and including including social activities, because those are important things, fatigue, and follow that before. And it also kind of keep in mind where you were before starting the medicine. And now, and if you can also, you can also share if you notice a change at any dose change or any, I'm interested in all those insights. Any and all of those insights will be helpful.
And there's
Um,
a comment section at the bottom of the surveys that you guys can put in, whatever information. If we didn't have it listed as a question and you think it's significant, please put it on there and we can always get that added in for further surveys down the road.
I'm gonna just like so I'm going to say that one of the hypotheses underlying all of this is, does this medicine have a direct anti-inflammatory effect on lipedema tissue? And that's now and now, this will be just sort of the first sort of uncovering the hole, but we will have to dig deeper. But if these, if it turns out that these do decrease pain, and without, you know, even before weight loss occurs, or decrease pain out of proportion to the weight loss, then I think that's going to be a really really interesting thing. Now, again, this is not blinded, so but that's still fine because again, if we find these things, and then we can do a more sophisticated blinded study. But that would require. So, I mean, let's be honest. So that would require some significant funding that I, as a personal physician, don't really have handy today.
I will tell you, ladies, that for the most part, I have had a lot of feedback already from our patients just starting, even just a couple of weeks in, already feeling less inflamed. So I'm hoping that that is, the majority of the clientele that this does that for, because I know that that is a huge component and a huge burden for our lipedema ladies.
Yeah, so I mean, Megan or Victoria, I mean, how does this all sound? What are your thoughts on on this?
That sounds great. I honestly, even more than the weight loss, the inflammation assistance is what's motivated me to want to
Yeah.
jump on board with all of it. After following a couple groups on Facebook that are particularly uh, women who are taking these drugs and then have been diagnosed with lipedema have seen such positive results. And I was like, I definitely can tell that my body struggles with inflammation a lot.
Yeah, and I've already given some thoughts of how that what particular targets in lipedema tissue and stuff, but that's maybe for another but because I but we but it's so I mean I wish I could get like your other if your other participants, other friends and stuff. I mean, I wish we could get as many people as possible. Obviously, the larger the numbers, the more statistical power we'll have and make a more convincing pitch to funders to study this more deeply. But I mean, it's really possible that this, may be one of the keys for driving. I mean, you could, I can put, I'm already working on how to write this up. Is one of the keys is of inflammation of so one of the most clear diagnostic criteria for lipedema is the pain. That's the most universally accepted diagnostic criteria, and and um, and and what there's some really good studies coming out of Germany on how there is, different sensation to pressure in very controlled in lipedema patients versus controls, and specifically where the lipedema tissue exists. So, um, like if lipedema patients do not have increased sensitivity to pressure on their hand, but further up their arm, they do, where the lipedema, if they have lipedema tissue in their arm, and they have and the contrapositive is they have um, decreased sensitivity to vibration in the affected areas, but normal vibration sensation in the non-affected areas, which is I find super interesting. And so if you say so, that really leads to the argument that there is an and what the primary there's three possibilities for why this increased pain is. I mean, basically you could have some neurologic different an effect on the pain fibers, but there's really no that's not or it could be inflammation of the tissue. So or there could be but there's not and finally there could be something in the processing, but but really there's I think the idea, I mean, obviously those all have to be considered, but the idea that it's some altered pain fibers doesn't really make sense if your foot doesn't feel your foot feels has normal sensation, but just up the foot has abnormal sensation. Well, it's the same fiber, so I don't think that's going to be the thing. I mean, everything really, if you think through this, everything sort of points to inflammation in this tissue leading to the pain, which is, leads to the, you know, the the expression of lipedema. That's so. Um, So that is boy, that was really nerdy. I'm but that's now you I now you can kind of see where I'm going there. And so anybody so more comments uh uh Victoria, do you have anything?
Yeah. Um, so Dr. Wright, like if I mean obviously it's good for weight loss. Like if I want to lose about 15 pounds. Is that something that you think it's healthy to stay on like once I reach my goal, like because of the other health benefits going on, like that you mentioned? Like
Right. For sure, for sure. I mean, first of all, let's also talk about, I mean, weight loss, excess weight really aggravates lipedema, and
mhm,
everybody being at their ideal weight would be the best thing that can happen. And now, and these medicines, again, so again, they've been around for 20 years, and people can stay on them for we presumably the rest of their life. But I'm not saying that that has to be so because in many of the studies that people were on them for just 6 months and then they either discontinued them or some went into kind of a maintenance phase where they reduced the doses. So those are all options, but presumably if it's reducing pain and I mean there I mean that would be a great argument just to stay on it as long as it's helping your pain. Again, we consider these medicines very safe. I mean,
mhm,
so I and something that I mean have so much that I would not. I mean, so I so full disclosure, Sarah and I, is all right if I say that, Sarah, that we both
Absolutely.
have are taking them and also have noticed a lot of health benefits from them. Um, I've noticed decreased pain in my knees, and I've had a lot of knee problems, and I have arthritis and had actually two knee replacements, and so and I mean it's helped my knee pain as much as anything, and for a lot less trouble because the knee replacement is no picnic. Um, the total knee is it's a semi-barbaric surgery. Any any surgery where hammers and power
yeah.
tools are used is not a you don't want to be on the receiving end of that. Um, so
I can kind of talk to the effects on inflammation. Just about 2 weeks in of starting the medication, I didn't even know that that's what I had was inflammation. I just knew that my hands hurt really bad, especially when putting compression on people. My hands would almost freeze up and stop working. My knees would be killing me. My feet would be killing me by the end of the day of surgery days. And just within 2 weeks of starting this medication, those sensations really resolved. And I haven't had any issues since I started taking it. So, I don't have lipedema, but I thought maybe I was developing arthritis in those areas. But since taking these medications, I don't have those pains anymore. So I'm going to attribute that to it was inflammation that I was having that I didn't know, and it's been helped by these medications.
I'm kind of curious. So with EDS and chronic pain, I've been prescribed low dose naltrexone
Yeah,
through
you're right. Yeah.
doctor. And then Nate was just reading that the tirzepatide can interfere a little bit with oral medications sometimes. So I'll be kind of curious I don't know how all of that will.
Yeah, I mean, for sure, it affects gastric emptying and delays absorption. But I don't think that it's. I mean, we do not. I don't think that it's going to have an effect. It's going to make your naltrexone less effective. By the way, naltrexone's really easily absorbed. It's pretty well. So.
Yeah, because a lot of what you were describing, Sarah, like I feel also I get pain in my hands and my joints and
Yeah.
especially long days. And then these weather changes really affect, like today was much better because we had a consistent cold temperature, but when we were switching yesterday, when we went from the really warm weather to the cold weather, then that's when my worst pain days happen.
Yeah, I definitely understand that feeling. And my kids are very active and we sit out at soccer games a lot, even when it's freezing cold outside. And I would definitely hurt terribly after sitting out at those soccer games and stuff. And that has not been happening to me since I started. So, I am very, very hopeful for you ladies.
Yeah, I hate cold weather. I hate cold water. All
Yeah.
of
Understood, because it makes you feel bad and that just makes you feel worse. But it's definitely been much more tolerable because it doesn't make me hurt so bad.
it's exciting.
Yeah, absolutely.
Did you have a question?
Well, I mean, does anybody have any like questions about what I went through, or any questions about diet or anything like that? Or I mean, I mean, we might just cut this a little short. I mean, I can talk about. I mean, I have some other things I can talk about if just I'm just
Dr. Wright wants to continue doing these about once a month. This was kind of just a trial to see if it was going to work. And I know that I heard back from a lot of people that this was kind of a hard time, a hard day,
yeah.
Trying to make it work for the majority of the people. So we may switch around, days of the week, times and stuff. Um, but we would like to have maybe like a topic or something for each time that we hop on. So if you guys have suggestions, please feel free to email me and let me know. And that way we can talk about it the next time. We don't want to keep taking up, you know, your time going over and over and over things, but if we have things that we can discuss and clear up any concerns or questions for you guys, that would be great at these little Zoom meetings.
Yeah, I think anything really, I'm trying to like think ahead and figure out how I'm going to incorporate more protein and like have kind of easy to grab snacks um, that will be more appropriate for the diet, and then also how to keep my water intake up high enough.
That is definitely something that these medications will do. They do decrease your thirst drive as well. So you really do have to constantly remind yourself to drink. I know a lot of stores, have like the little nut packs with the cheese and stuff like that. That has been a game changer that I just have that around because it really does decrease your appetite during the day, you have to tell yourself, I need to get some protein in. And so just even having those little snack packs and stuff, and you can make your own. I mean, it'd be much cheaper to make your own, honestly. Just having those around
Yeah.
makes it much easier as well. And Dr. Wright, do you want to let them know about how many milligrams of or how many grams of protein that you are wanting them to have a day?
Well, I want them to have at least, 60 to 100 grams of protein a day if it'd be ideal. And I want to make sure they're having fiber, to keep up their gut health and, that, you know, um, I don't think, as far as like macros on carbs, that's tricky. I really think you should focus on quality carbohydrates, so not complex carbohydrates from whole foods, not processed foods, and not refined carbs, especially. But I mean, you still should have probably eat more complex carbs than protein, or at least close to that, and then lots of good healthy fat. So it can be variable. You can eat more protein and fat, or still have a fair amount of carbs as long as they're healthy carbs. And the most important is to keep the protein up, because that if you don't keep your protein up, you might want to lose muscle mass or things like that, and that's always a concern when you're losing weight.
Awesome.
I got to write. I'll compose them.
Oh, okay. I guess Nate has a complex question that he's going to email.
Okay, sure.
And
Yeah,
then I forward that right on to Dr. Wright.
Yeah, okay,
and you can nerd out as much as you want with him.
Okay.
Um,
Yeah.
yeah, I think my biggest concern with it was just having a history of chronic constipation and making sure that that doesn't.
No,
interfere.
it will cause constipation. So I mean, I think everybody should be on a magnesium supplement who's on these medicines. And then if you get into more problems, then including like a small dose of milk of magnesia or something, or other whatever I think there are other stool um, softeners and things like that. But you definitely do not, you don't want to get backed up.
Okay. Yeah, I think that would be I would appreciate a topic of kind of diet and shared recipes or things like that, or suggested meal planning
Yeah.
combinations and things for
Okay.
future discussion.
Okay. I'm making note of that. Vicky, do you have any questions or suggestions at all?
No, it was very informative. So thank you, you guys. I do find it interesting about the inflammation because I developed tinnitus. Like I had COVID in 2020, and then all of a sudden one day I just started getting this like light buzzing sound in my ears, and I thought it was like our refrigerator and all these things, but it comes and goes. So I feel like that's inflammation related. So I would want to see like, and my thumb hurts like just probably from typing and stuff. So I don't know if it's arthritis, but I do want to see if that would help like ease some of that because I do feel like it's inflammation. So that's interesting that you said, Sarah, that your joints feel better and everything.
Yes, they do.
Yeah, so I would like to see that. Um, could Keith participate in this or does it have to be someone that like does it have to be someone with lipedema or could it be in general someone who has regular weight issues?
Yeah, I actually I'm not sure about that. So I want to start with my lipedema patients we're studying, and really, but I think that's something Sarah and I are talking about, expanding this to um, people not in our study.
Hmm.
I I mean, but on the other hand, I want this to be, kind of a nice thing. It's sort of a, um, I also want it to be something, I don't know, an advantage or a nice thing for the people in the
Hmm.
study. I, we're going to kick that around, but we want participation. So we're hoping, I mean, obviously this is a little bit right before the holidays and stuff like that. And we're gonna, share the recording, and we're gonna do more announcing of the next meeting. So, but our hope is to, get a more robust uh, interaction and dialogue, and yeah.
And we're
Will
all
you,
each other,
oh,
I
sorry,
think,
sorry.
too. I'm sorry, Vicky.
I was just gonna say, will you guys, what if you put it on Facebook or something and you incentivized it, like said people would get a small discount on the medication, like, and then you could, have them go in and evaluate them, and if they do have lipedema, um, they could, maybe that would like just help people to be more motivated to do it who have lipedema.
Yeah, yeah, for sure. I mean, we got to think this through, but I mean, we're thinking about those sort of things. So, um, yeah, I like your thoughts. Thank you so much for joining us, and really appreciate. I know this, time out of your day is precious, and this, but I thank you thank to everybody who's participating in this study. It means so much, and hopefully it'll make a huge, we'll be able to, it'll be a huge tool to help more women with lipedema. um, so that's that's my hope, and but you have to start with these baby steps.
Are you familiar at all with how far away we might be with insurance covering these medications when we're outside of that diabetic diagnosis?
We are so far away, you have no idea. This is like, I mean, first of all, right now, of course, lipedema is not there, it's not an indication, but we would have to have, you know, like this study, then more detailed studies, and randomized controlled studies, and then all those would all have to, point towards an indication. And then, even when there's a reason, or a good, you know, fully, you uh, powerfully persuasive reason, the insurance companies have to want to pay for these things. So right now, I mean, they're not even, the majority, 80 plus percent, maybe 85 or 90% aren't even covering it for obesity. And it's an indication for the medicine, and so, yeah. So I mean, it's a big road, but you have to you have to start, and you know um yeah.
If anyone's going to try to get it covered for you guys, it's going to be Dr. Wright.
Right, right. I there's
Love
look
to
it
talk
it,
to
it all starts it all starts with a few committed individuals. That all great changes start with a few committed individuals, and that's how no, never been any different.
Awesome.
All right, I'm going to stop the recording, and